Thank you very much for a kind introduction. So before starting my presentation, I would just like to confirm, am I audible and my slides are visible to everyone? All right. So thank you very much. So first, I would like to thank Professor Muhammad Al-Barai and the Conference Secretariat for 17th Al-Ainy conference and for inviting me on this forum, and a very warm welcome from Karachi, Pakistan. So with this COVID pandemic, at least while we are staying at the comfort of our working places or our home, we are able to interact, which is a new mode of connecting with each other and dissemination of the scientific knowledge. So let's just start with the first concept of. So linking to the theme when we were discussing about that, what could be the potential topic that we can discuss, then we come up with this one topic that what about AI? So to be a top ranked institution, does every institute would have some expertise about artificial intelligence? Is there any potential of this AI to change the landscape of managing the liver diseases or not? So I think this is something pertinent we can review and we can learn, and whether this is a promising field or not, the people are having difference of opinions, but we can discuss and we can review what is an existing evidence. So I don't have any conflict of interest to deliver. And as this is a topic where in general, in many scientific communities, including the GI community, the knowledge is not that widespread. I'll be limiting this 15 minutes talk on this wide subject to the basic information about how the AI works and what work has been done in the field of liver diseases, very few examples, what are the challenges, and what is the way forward. So how are our life as hepatologists and gastroenterologists? How do we think? How do we manage the patient by collecting the information? So basically to diagnose, prognosticate the disease and outcome, and recommend a potential or the best treatment, as well as to prognosticate the effect or outcome of the treatment, we as a clinician use the different diagnostic information and the data modalities, which is like medical history, clinical data, genetic data, histopathology investigation, radiological imaging, laboratory parameters, and then all of these are actually aggregated into an assessment, and based upon that assessment and existing knowledge, we manage our patients. However, on the other hand, we know very well that interpretation of these information, which is huge, about even if you talk about a single disease, is very challenging task, even for the seasoned clinician, and the diagnostic ambiguities abound in hepatology. For instance, yet for a very common disease, for example, non-alcoholic fatty liver disease, the gold standard is liver biopsy. But in terms of non-invasive parameters, though we have now better non-invasive parameter to diagnose and then assess the treatment, but still there are some gaps. So is there any potential option to simplify this process? Can we make it more user efficient, more smart, more intelligent? Which brings again a question that is machine learning or a deep learning is an option? So with this, for the beginners and especially the trainees, I would like them to go back and just think about that, what intelligence is actually. And that actually will help you to understand the concept of for AI if you haven't read this topic still. So it's been described and defined in the various ways. For example, in general, intelligence could be briefly defined as the ability to memorize and learn from an experience, capacity to think and to be creative, ability to speak, capacity to judge and make the decision. And this is all of these processes are actually involved in our daily practice whenever we are seeing a patient, we're managing a patient. And what artificial intelligence is? The capacity given by the humans to the machines to memorize and learn from their experience, to think and to create, to speak, to judge and make a decision. Very wide a definition. So AI is therefore a copy of human intelligence. It aims at reproducing human brain function. So it's not a new subject, though. Over the last couple of years, lots of like rapid progression has been brought in the various field and the modalities. But the concept started in 1950 with an artificial intelligence concept, and this was is actually as a kind of premature practice in a form of technological science, extending and expanding the human intelligence, various predicting models, imaging modalities to identify the disease characteristics based upon their morphological feature. These were the certain example. Progressing to that, then the concept of machine learning came in, which was a core of artificial intelligence, which means about that to study how the computers simulate or implement the human learning behavior. So the deep learning is a kind of machine learning where discovery distributed feature of the data by combining the low level feature is actually help you to draw the conclusions. So this machine learning requires many data to train, which systematically improves the computer performance in the processes. Trial and error, and then you reach to a model which actually become more efficient and then accurate. And by doing so, the computers are able to shed light on the previously uncertainable relationship that the traditional statistical method could not detect. So the machine learning is also capable of analyzing the data type that were previously unavailable for the advanced computer analysis, for example, images and the text data. Lots of radiological and histological images are an example in this field. So in AI, actually, the computers to learn from a complex databases and solve the real world problems via computational approach to the data analysis in which the computer programs are not explicitly guided by the expert, but by primarily learn from the examples. So that there is a lots of process involved in the AI. So with the interest of time, I'll not go into the detail, but these are the different types and the terminologies used for the artificial intelligence, different type of the networks, and then again, the concepts behind the AI, and you can spare some time to read about it. So what is actually expected? The expected is the AI can provide an accurate diagnosis and the treatment for the complex diseases, reduces the medical errors in making the diagnosis and prognostication, promote the development of the medicine and make it like more feasible to treat the patient. So where are we standing? We are standing over here most of the time where the narrow AI is there, which is dedicated for one task. For example, the identification of the degree of fibrosis in case of non-alcoholic fatty liver disease. AI is helpful or not. This is one task. So we need to move forward to the general AI, which actually can link and combine many narrow AI processes, and with that, it becomes super intelligent. Super intelligent, just like human, or maybe more than that. Maybe more than that is a dream at the moment, I would say, at least in the field of hepatology. But this is what actually is expected. So there are many studies in recent years have suggested that the machine learning technology has many potential uses in hepatology, ranging from exploring new non-invasive means to predict the diagnosis, to predict the treatment responses through automated imaging analysis. So the large number of studies are available. Most of them are from United States and China. Rest of them are from these other countries. So which type of models, I would say, or the type of studies has been conducted so far most of the time? Segmentation, prognostication, diagnostic studies. So these are the various type of studies that are actually being conducted so far in the field of hepatology. A number of studies are conducted on the various type of imagings, including like to identify the fibrosis, tumors, identification of the NAFLs, degree of statosis and all. And a number of studies which has been used, they gathered the data from the various type of imaging modalities, including MRI, CT scan, ultrasound, histopathology, and few of the studies has combined the two imaging modalities, for example, the CT scan and an MRI. So here you can see that with the passage of time, the cumulative number of the studies has been like increased gradually. Most of them are actually aiming towards radiological and histopathological workups, and many of them are handcrafted or deep learning based concepts which has been utilized. With this all, so where we can actually utilize this AI. So what the data says, let's see that. So seems like that the most common application is something like automaticity in the diagnosis of liver diseases from the imaging data, prognostication prediction based upon imaging data, histopathology data, or a combination of lab parameter plus minus clinical parameter when an algorithm with a form of machine learning could be developed. Segmentation studies were aimed to generate an accurate eye plan along the region of interest. For example, the algorithms that can delineate the organs at risk before radiation therapy for the cancers. However, almost all of the published studies addressed either neoplastic or the metabolic diseases of the liver. In the majority of the cases, few of the studies actually address the viral hepatitis diseases as well. But again, there is wide variability in the field of the diseases, which is still need the learning and application of AI. So the one example over here, the picture is showing that, for example, so there are two main categories which actually show the promises. The one is like this radiomics, which rely on the classical machine learning, where the lots of images are used to predict various outcomes. And this is deep learning system, which actually relies on sensory neural networks. So here just to very simplify the concept, lots of imaging inputs are there. They're handcrafted feature addressed, and then there with the help of deep learning, all of these features connected, combined, and analysis are done, and based upon that, supervised learning target is achieved, tested, retested, and reached to a level of automaticity. On the other hand, again, the various studies has involved the process of segmentation, classification, and the prognostication. So this one meta-analysis has reviewed what type of studies has been used to identify chronic liver disease patients, and especially for the patients with non-alcoholic fatty liver disease. And here you can see that the diagnostic accuracy of AI-based diagnoses has been reported to have a reasonable sensitivity, specificity, and the accuracy. And hence the author concluded that AI assisted system has a promising potential for the diagnosis of liver fibrosis and fatty liver disease. Segmentation-based studies on the deep learning tools, they has been tested and used based upon quantitative abdominal CT for the estimation of the liver fat. And it has been concluded based upon these studies that these CT tools can provide a rapid objective assessment, which actually can be used in large prospective cohort studies, and especially the screening study, which could be better than simple ultrasound and lab-based screening for fatty liver disease as an early identification. Likewise, the deep learning system for the staging of fibrosis by using the portal venous phase CT images, this was another modality has been used. And here the radiomics of the elastography beside that in this area has also shown a promising result. So in case of imaging omics, what happens in omics? It mainly extracts a large number of influential features from a high throughput radiological images that you actually give to the computers, and then uses the statistics and AI algorithm interconnected to each other to select most valuable imaging omics to construct a predicting model. And in essence, the significance of imaging omics is to dig deeper and deeper and deeper information of traditional medical images to compensate for the deficiency of the human eye. AI, and to come up with something, a model you can say, or a testing mode you can say, tool you can say, which actually could predict either a diagnosis, the response to the disease, or there are so many other areas where it can be applied. So another AI-based predictive model for hepatocellular carcinoma reduces the misclassification rate by approximately in half of the cases as compared to a single tumor marker, which could be a blood one or based upon a CT scan. So this is another area, the multiple studies are available. But what are the challenges? So if you just put on the PubMed and or on a Google Scholar, there will be thousands and thousands articles will be coming. There will be hundreds of studies conducted in this field. So with this interest of time, I'm not going in detail, but I give you a flavor about that. What are the areas where the AI is actually shown a promising result in the management of the chronic liver disease? So with that, why not actually just rely on the simple imaging? They are good. We have been using for years and years. Are they not sufficient? So there are lots of problems with the imagings as well. For example, multiple imaging studies sometimes are required to make the to reach to the diagnosis. Sometimes they are not confirmatory. The biopsy, for example, of the liver of lesion, or in case of fatty liver disease, is having in itself lots of few at least complications. So can we come up with more easier, better way whenever utilizing these imaging based data? So this is what people have explored, and the data is coming that the fusion technologies of true imaging or a combination with histopathology actually can give you better diagnostic and prognosticating modalities. So because we know that the imaging may provide you inconsistent definition, the follow-up and to assess the disease response, these are the few challenges with the existing imaging modalities. So what else the AI could be used and has been used and tried through building up a prognosticating model. For example, the response of the treatment in case of patients with hepatitis C and HIV, the studies are available to identify the patient which could be the non-responder for directly acting antiviral therapy. So these model in form of AIs are available which show a reasonable performance to provide a personalized treatment advice. For example, there is a small lesion on an imaging. It's very small. You will be having a difficulty in doing a biopsy. So you can you use AI to prognosticate whether this is just only a nodule or this is an early HCC. So for that, the studies are available about the fusion of two different imaging modes in here. Here the response and then the technical response rate for the diagnostification and the treatment response was found quite significant. Another use of this AI in the field of hepatology was the clinical decision support system tool, which is a software that is designed to be a direct aid to the clinical decision making, in which the characteristic of an individual patient are matched to the computerized clinical knowledge base and patient specific assessment or the recommendation are then presented to the clinician or the patient for the decision making. So this is actually just simplifying the thinking process or making it more user efficient for the clinician, which could be useful. For example, the trainee could use these type of softwares whenever the patient are presenting in emergency room and all and all and all. So the study, another type of study is actually used to identify or predict the hepatotoxicity of the various drugs are used. So when so much of the data is available, so what are the missing link which are keeping us far away from the destination we are aiming for? So the major challenges are the standardization of imaging analysis, the diversity in the data available, whatever you talk about, one type of modality of imaging or histopathology or lab parameter, and the biases in database curation, as well as the validation process. And all of these factors actually affects the validation process, and that's why you may have found variability in the existing data about AI use in the liver diseases. So the liver diseases itself, they are complex problems, and they rely, as I said, that based on this data. And other than that, you can say that the AI is actually built on further data in a form of digital images, tubular data, and top of it, it further layered the utilization and the processing of the data, and gives you the simple output in terms of outcome you are assessing. So what are the challenges? So the wide gap between the going number of the research article and the limited number of clinically approved application of AI, this is something which actually raises a concern that we are right now quite far away from the target we are aiming. So this discrepancy is actually exacerbated by many external and prospective validation of the models, various reasons, including this lack of technological infrastructure in health facilities, lack of knowledge, and lack of trust in artificial intelligence systems among the medical personnel. It's still a a big area where the human is actually questioned that could AI induce models be intelligent just like human beings? Can these machines think better and work better than human beings? So there is again a big question of trust in this field, which is actually bringing us far away from the achieved targets. One reason. So this is possibly due to the complex nature of hepatology and the liver diseases, which depends on the single data type for the diagnostic and the clinical management. So it was a very simple talk. I kept it deliberately just to give a flavor, because I know that the audience is a diverse group of audience. So the take home message is, although the promising data from preclinical studies are now available, especially in terms of certain aspect of diagnosis, for example, for the fatty liver disease, for fibrotic, for early identification of the fibrosis in case of HCC, predicting the response for HCC after the test, and all in all, the application of AI in liver diseases is still far away from being applied in clinical practice. So for a good hepatology center, there is a great potential to build up expertise in this area and to have better inventions and definitely more better model, which actually could help in this regard. So the application of AI in liver diseases deserve further study, validation study. There is a huge gap in knowledge and understanding among our own community of GI. Interdisciplinary teaching and training would help development of expertise, and collaboration would help developing the expertise in the various institutions. So the AI will support in general what I think, rather than replace the doctors or the humans, although the computers and healthcare workers will have to work together. Ultimately, healthcare workers will have to make the decisions for their patients based upon their preferences, circumstances, and ethics. This is what I think. But would this AI replace the human doctors, and robots will treat the patient in a better way? It's a human dream, or at least equivalent to the human. It's a dream, but will it come true in our life? I'm leaving these questions to the audience and other panelists. So thank you very much for inviting me in this forum and kind listening. Thank you.